first of all, congratulations on getting this through. I mean, I think anytime you get through anything, including with tissue through regulatory approval, it's a big challenge. It's non-synthetic, and there's just so much buzz around it. And here we have now the ability to do it with your own body. I can do a liposuction case, and I can send it to you. We can send it to T&CT, and they purify it, they optimize it, you freeze it, and then the patient can come back and literally in 20 minutes, almost like putting a filler in. And then they just put in 150 cc's at a time, and then they can say stop when they want to stop, and they can kind of, I mean, it's almost like instead of choosing an implant, you get to slowly grow into it until you make your decision. I mean, it is the most customizable way to do it.
Customizability is really what you're hitting on there because with an implant you can get volume, right? But it's volume in the size of the implant, and if the implant shifts, then that's where it goes. Whereas when you're grafting something, it goes right there. It's not going to shift from here down to here. It's not going to, once it's grafted in there, it's living tissue. It's there for life, and it stays with you. There's no risk of implant rupture. There's no getting either an ultrasound or an MRI every few years, right?
It's you.
It's you. And the other one is that if you go and you're looking in the mirror and like, well, I see this here, but I'd like a little more volume right here, or I'd like some more volume right here. You can go to your surgeon and talk to them and say, hey, look, I think this needs a little more volume right here. And you go and do that right there in the clinic. Because as you mentioned, you don't need to have, a general anesthetic. Oftentimes you don't have to have a general anesthetic for liposuction all the time. But in my practice, I see that quite a lot, that patients request a general anesthetic for liposuction. And you don't have to have an anesthetic, and you don't have to have the compression garments. You deal with it once, get it done, and that's also the highest quality fat. Because as you know, like when you go into second and third time, you have more fibrous tissue, you have more scar tissue, and they're just grafting in scar, which is not going to come out like fat because it isn't fat.
This is the implant they want. They chose, they showed a picture, and then it's on them, and it actually looks like the picture, but they're like, ah, it's not exactly what I wanted. Maybe it's a little smaller than I wanted or bigger than I wanted. Even, and they'll acknowledge, they'll be like, yes, this is exactly as we had decided with the picture. When people are making a change in their body, whether it's breasts or buttock, they see a picture in an image, but they haven't worn it. They don't see it on them. And with all the information that you give them, they have to do this. This gives them a chance to actually really grow into it and say, I'm happy now. This is, I can stop. And if I want more, it's later. Can you explain just the process of how we're able to achieve this? I mean, it seems magical that I'm able to do liposuction and get, I mean, we saw with us with 90% purity. So what's the magic?
The magic is really the ability to freeze fat and have it live when it comes out at the other end when you thaw it out. So as you know, like fat grafting is not new. We've been doing that for a long time with BBLs and breast augmentation, natural breast augmentation, and you can do it right as you do the liposuction and immediately put it right back in, and it doesn't have very much time out of the body, so it survives just okay. The past, it's been a very, very difficult process to be able to freeze fat and actually store it for a long period of time and thaw it and have it live. And that's been the real breakthrough, is that you can take your fat and you take a large volume of it when it's the best liposuction, the best harvested fat is in that first round. And so you can take that really, really good fat and store it for later. And then in small increments or large, depending on how much you want to thaw out, you can take out from there. And it's basically your safety deposit box, your piggy bank. You can take out from your piggy bank and then go and graft it in later on.
And so this is amazing because fat is, I think that people don't realize fat is now used really in two ways. One as filling volume,
Mhm.
and that is mostly face, breast, buttock, even hands. So one is as a natural filler because people don't really, we deflate as we age.
Mhm.
So a lot of that is the deflation. But I think another thing that fat is being used for is the discovery that most of our pluripotent stem cells, most of the mechanisms of healing and combating environmental stressors is held within that.
That's the amazing thing, is that the fat actually contains what's called mesenchymal stem cells, and those stem cells are the ones that will differentiate, turn into your fat cells, your bone cells, muscle cells, cells that create cartilage, like chondrocytes, and those kind of things. And those are really important cells that oftentimes we want to kind of look over, but they're really great because that's really about how you get that longevity. How do you feel good when you're out living life? There's a lot of those kind of cells, so it's very, very important, and it's a great place to harvest stem cells.
So you have this in the bank, and one you have for volume if you want, and for two you have for regenerative purposes. And
Right.
I know there's a big thing in regenerative. There's so many ways it's used, but the way I see it, and you can correct me if I'm wrong, it's basically taking are capabilities that are silent and reintroducing it, almost like if we had a CD and the CD was scratched, it's wiping off some of those scratches. And when you actually put fat in the face, it doesn't just create volume, but it also allows better healing of your skin.
Say like you put it in the face and you use it as a volumizer, bring that face kind of out as well. But then also there's the stem cell therapy that's in there and helps regenerate things that are in there. And so there's a lot that we don't know about stem cell medicine. It's done more often because as you know, T&CT is a worldwide company, and stem cell therapy is much more common in other countries. And so a lot of the data that we have from stem cell therapy comes from these other countries where it's much more common. And so it's really showing that you can then basically have those stem cells there to really help out for, again, as you talk about healing, getting the cells to be regenerative.
Surgeons that I respect tremendously in Europe, and they had their conference in Ghent that they have every year in Belgium. They had NIH research. I mean, they got really nitty gritty from how we went from single cell organisms to multi cell organisms and how this comes into play. And it was really mind boggling. A lot of it's theoretical, but then the concept of biohackers. They were talking about data during COVID with people who were doing their own things,
Mhm.
sanctioned, and their rate of getting seriously ill or intubated. And yes, it's retrospective and it's not complete studies, but in anything that you look to study, once you see high correlations, it could be right or it could be wrong, but it does make you want to investigate it further. There's enough there that the investigations need to go forward.
I would agree with that. I think there's we don't have the full picture, but there's a lot there, and there's a lot of exciting stuff that's there to be able to show regeneration, and also in many applications outside of just even aesthetic surgery. And they're using it in regenerative medicine for joints and things like that, and arthritis. Athletes are using it, and they're getting great results. As you said, there's a lot of anecdotal research, there's a lot of research that's been showing for in other countries showing this being very useful, but there's still a lot to be done, and I think it's very exciting. I agree with you. There is definitely a need to do a lot of research here to really show what stem cells can do.
And so for your product, which we're so excited that we're gonna be, I mean, we're offering this now. We're so excited for it. I
Mhm.
think that there's a lot of misunderstanding with fat grafting for the buttock, for what people call BBL, or even for the breast, where they go in and they say, I just want as much as I can have. And one surgeon will say yes, one surgeon will say no. I think the data overall is, anywhere from 25, 30% to 60%, no matter what is going on. And I think a lot of that has to do with how everything is processed and also how much you're putting in. What's your take on this? What's the most efficient volume you should put in per session? Is it 100 cc's, 200? Because people want to put in 500, 600 cc's, but at a certain point, you're just doing it so that you know people feel good for the first week.
I think it really comes to how much volume as far as the size that you want to graft into. In the sense that if you have a very small area, it's a 3D space. And so if you think of the globule size, the size of the fat you're putting in there, if you have it as like a basketball, and I make an imaginary basketball is this big versus this big, the amount of the distance for the blood to kind of come in to get to the center, and actually the nutrients to get to these grafting in fat cells is farther for it to go. And eventually, if it's too big, it's too much distance for these blood cells to really kind of go and actually create new vasculature that they die. And so if you can keep it smaller, that's where you have that optimal amount. And so, and have it all live essentially. And so that's why the idea of doing these multiple smaller rounds is very, very good. But then we have to think about it in a 3D space, because if you have something that's here, but it's super long, you can put more in it. But if it's just this much, you put less in it. So it does depend on the whole total 3D volume. And that's where you kind of work with your surgeon and talk to them and say, hey, look, this is what I'm looking to do. I'm looking for this area of my breast versus this area, and how much area that you're really wanting to cover. And that'll help your surgeon kind of determine really how much he or she wants to put in there.
Correct me if I'm wrong. The way I explain it to patients, because a lot of patients will go traditionally, they'll go to a lot of my colleagues. And, I would say even 4 years ago, someone says, I just want a breast augmentation. I want 400 cc's. I want to go 2, 3 sizes. And they say, I want fat. And it was difficult for me to really say with any confidence. I'll be like, well, I have no idea. It's hard to say. And then the way I break it down is, it's almost like farming. You needed to have the best quality input, the best seeds, the healthiest fat cells. And then two, you needed to have the healthiest recipient sites, or the best farmland. You needed to think
Sure.
that land was, the soil was ready to get it. There's been a lot of excitement because there's so many ways to get to optimize the fat now. I mean, There are surfactants we use. There's your process, and I think that even what you're left with is you're ending up with a higher proportion of fat cells because of the gentle way of freezing it and unfreezing it, and so you don't need to mechanically, push the water and the fat out. So you're getting pure fat that you're putting in. But once that was solved, then the other problem is the soil, and at a certain point, you're limited by it. We find that after 200 cc's, you kind of fall down a cliff in terms of what it can do. You're just putting it in to look good for a week. The optimal is probably, up to 150, 50 to 200, you're okay, cc's, and then it falls out. But that would mean that I'd have to beat up someone each time. The injection of the fat into the buttock or the breast it's pretty painless.
Yeah.
There's
Yeah.
there's nothing there. It's so gentle. It's in an area that doesn't have a high concentration of nerve endings. It's meant to expand. There's room for it to go, especially when you keep the volumes low. But then I have to harvest the liposuction. Liposuction is very little downtime in terms of medically, but you're sore. You don't need to go to sleep necessarily, but you're gonna have some drugs and there's a recovery period. There might be a day or two off work, even though that's minimal. If I know that every, 6 weeks I'm gonna take 2 days off of work and go through this
Yeah.
process again, that's really daunting.
And that's actually one thing you kind of brought up that, like, for folks that are saying, well, maybe I want to have a breast augmentation, with an implant. And well, is this one or the other? And I don't think that's the case. You can go and harvest the fat and save it for later. And then you go and have your implant. And as you look, you say, well, it's kind of too funny. I want a little more up in this upper pole. It didn't feel quite right. Just so you say it, you look on pictures, but until it's on you, you don't really see it. It's hard to really envision. But once you see it, and you're like, I wish I'd have a little bit here, a little bit there. You just go and get a little bit touch up so you can do it in clinic, if you want to.
It's not just a big brush. This is also a fine brush. I mean, this
It's
is
a very fine brush as well.
this
That's
is
the
also
key
something
difference of fine brush.
this enhances even most aesthetic surgeries in terms of
Mhm.
even if you're doing something, you're making a drastic change, but it's those fine little edges and contours. There's a degree of healing in the body that, there's no magic here that I can wish a body to heal exactly as I want. There's always a degree of variability for each individual. And I mean, I just think with something like this, it just can give you more confidence to say, all right, with no pain, with no disruption to your life, even if there is, a fine brush that we need to, it's there. We got it. We got you covered. You don't need to do anything. Let it heal the body. And no matter what the body gives us, we can work with it. Like
Yes.
we're organically working with the body instead of forcing it now.
I kind of look at it as like a paint roller and paintbrushes is that, surgeons are artists and they're trying to, get the most aesthetic outcome for the patient as possible as they work with the patient and talk to them and try and do this, but they're trying to, sculpt and mold in that way. And if you have just a paint roller, you do the best that you can. And that's the only tools that you've got. But now you've got tools where you can have very fine paintbrushes when you want them. And you can pull out the fine paintbrush and just do little bits here, there, little touches here, and there, and get the exact outcome you want.
How long can you store that? Forever. I remember when I was a resident, they would take some fat for facial fat grafting. This is back, I don't want to date myself. Just put it this way, fat grafting's been around for longer than I'd like to say. But
Not new, that's correct.
and they would freeze it in their little tiny, freezer or put it in the fridge and it just didn't seem like that was gonna work. So how long in this situation, like, does the metabolism go to 0? Does it slow? Like, what's your timeline and how long you can decide? Can the patient decide anytime they want, or they have like, you got 6 months and you gotta figure it out?
The metabolism of the cells goes very, very, very low. And so we don't know the exact length that we can have as far as the upper limit. We've had, because we've been around for about a decade, we've had folks that have had fat banks for 8 years, 8+ years, and have no loss in viability. So you can keep this stuff stored for a long period of time and have no loss in viability of the fat because as you say, metabolic rate goes way, way, way down and have that there. So you have time and you can store it for long periods of time. If you wanted to go and get your stem cells now, and then you later on, say in 5 or 10 years, you're hoping that the U.S. starts to change its view of
Or like to
aesthetics.
amplify it, yeah.
Yeah, you can use your younger stem cells to treat you when you're older.
In some of these international conferences that I've attended, you hear and it sounds like cuckoo where like family will take from the fat stem cells from younger relatives and then inject it into them. And it's a little like vampire, but it's really surreal where this is moving. There's going to be a lot of charlatans, and I think that's
Yeah.
why it's good to get it out. that are going to say, use this, use that. There's fire under the smoke.
Yep.
We just need to make sure it's being done responsibly.
All of our tissue is autologous, means it's just you. So we don't have other people's tissue. And unfortunately, you can't say like you wanted to give to your brother.
Yeah.
We give it back to the same patient in that sense. So we don't have that.
Some of the preliminary things that I've heard, and you can correct me, is that in some situations you get over 100% volume retention when you inject. I can see how it happens, but is that a thing?
The way I can think about it is that you have the fat that goes in there. Fat can go in, that can live, and you can graft in. Okay, fine. You can get a certain amount of that. You have the pericytes, which are peridipocytes. They can then graft and they can become them as well.
So just for the patient to understand, there's cells around the fat that have, just like there's stem cells that can turn into muscle, there's cells around the fat that can also be influenced to
Become fat.
change their clothes. Yeah.
Yeah, and they can grow in the sense that your number of fat cells is kind of, I like to think of it as locked in at puberty. When the number of fat cells you have is pretty, reasonably low levels, that's locked in at that level. And you gain some of those. When you gain weight, you don't gain more cells. They get bigger and smaller. Periodicites, they can grow into fat cells. You can make more of them. They're looking from the external side, just looking at how big the breast looks or how big they look. There's going to be some level of inflammation as well, as that's kind of actually a good thing. People are always, oh gosh, inflammation. But when you have inflammation, that's also the body's healing mechanism. That's where it's going to need to really graft that in. And so some level of inflammation is not bad.
You were talking about the breast cancer and all these things. That after radiation, I mean, it's really hard for a lot of people. The treatment sometimes is pretty rough.
It's very rough.
Then they cure their disease, but they're left with the effects of the treatment for the rest of their life. When you put in healthy fat, as you do not unhealthy, because if you're putting in healthy fat, and in fact, you could do harm. If there's a lot of bleeding in there, there's blood, and it's bad inflammation. When you put in the healthy fat cells, do you see increase in blood supply? Let's say potentially softening of that skin, irradiated skin, of just increasing the overall health in the environment, because you're almost bringing in new healthy blood supply and tissue.
It's super exciting. That's the exciting stuff. I mean, T&CT, when the original application in England was for breast cancer, and that's where the majority of the data comes from, is use in breast cancer. They have over 1,000 cases, of just treating folks for this and really helping them out with, as you say, the good fat before it has all these things where the treatment is, I mean, it's good. It kills the cancer, but you got to kill the cancer before it kills the patient, because it's a horrible, horrible thing. And it's not very good on the body. It's very harsh on the body. There's some level of rejuvenation that happens because you're putting healthy stuff back in.
What's the most session that you've ever done on a patient? How much is the most you've ever
Oh,
grafted
God.
in? Have you created?
I'm at Pro Plastic Surgery here in Olympia, Washington. So it's definitely the Northwest. So they want more of the athletic build, and they want a lot of more of, not as much of the large volumes. And so, no, not super large volumes. I mean, obviously, BBLs are going to be the largest volume for the Brazilian butt lift to add into the buttocks. That's going to be the largest volume. But I think you're looking at, 500 cc's per buttock, in that range. They don't really want large. We're not talking, over a liter per buttock kind of thing. Maybe 600 in a buttock. But a buttock is a very, very large area.
There's only two real ways I know where you can purify cells like this. There's your way, and with using the surfactant. And when you put it in, it's funny that 150 cc's in a breast, when it's pure, doesn't look the same.
Yeah.
Put 150 cc's of mixed aqueous and
Yeah.
fat that has blood in it. It doesn't look the same. It has more, even though it's the same volume, it creates more of a filling effect.
And that's the thing that a lot of patients don't know, is you bring up a very important thing where fat isn't fat in that sense. How you harvest the fat, how you do the job. Like, surgeons are artists, and they know the science and know how to do this stuff. And the way in which they do it, there's different ways of doing it and for different applications. And one of them, as you mentioned, is that you can kind of take out all of those contaminants in there, and you have this really, really high quality fat. Well, a lot of it's going to graft, and then it's going to be there, and it's going to look different than when you have a lot of other things in there, the stuff that you may not want. And then as the body resorbs it, it gets smaller.
It resorbs unpredictably.
And it has a different purpose. In this case, when you have really, really good fat, you don't need as much of the volume. And when you put it exactly where you want it with smaller volume, you don't need as much volume. And then you can come back and say, okay, well, I need this little bit here, little bits there. And you can just touch it exactly where you need to and really get the exact look you're looking for.
I think this is fascinating. I'm so happy to now be able to offer this. I mean, you can just imagine someone who's gone through breast cancer either has a flap or an implant. When people talk about breast cancer survivors, often they're talking about surviving the treatment. It has a high rate of survival, breast cancer, but everyone gets hit by that kind of
Yeah.
that just process, that grind.
It
And after
hurts.
that grind and they're trying to be restored, then you have to say, "Oh, you have to go and get beat up for 5 more procedures." Or we can do one time and you're doing this, we can do liposuction, and then you don't have to suffer for this again. We can slowly work with you in such a seamless, easy way.
You're preaching to the choir for me. I agree because I would want exactly as you say. I would want to have one round with the healthiest fat possible and have multiple rounds of liposuction and have multiple surgeries over and over and over again to try and get this thing. And then eventually what I see in patients is that they go, yeah, it's not right, but I don't want to go through the hassle again. And that's not right either. There was a law passed in the US saying that, hey, look, we got to give ladies breast reconstruction. It's the law. And it's kind of, I almost feel like, I think this kind of stuff should be available to people so they get the full
It's
reconstruction. So
it's more compassionate too. It's like, it's
yeah,
just I don't have to hurt you as much. This has been used for almost a decade now outside of the United States. It's only now getting introduced. I know you've had a ton of experience. I try to explain to people this is not experimental. It's just something that we know that we've been prevented and now we are we are allowed. There's nothing new about this. The science behind it has been around. We've been doing these things for decades upon decades upon decades.
it's not,
And the biggest institutions in Hopkins, and I know that some of your investors from Hopkins, University of Pittsburgh, some of the big stem cell research wet labs in the country. I'm so excited. We're one of the few clinics that are going to be able to do it. I think it's pretty groundbreaking.